focus on these muscles on the inner thigh, part of that chain that runs up the inner leg line. And these are called the adductors. What happens when these muscles get tight is they kind of pull on the medial side of the knee and right into the knee, sometimes creating some tension in the knee. Also kind of rotates this leg inward, so it creates some problems when we squat. Coming down, the knees can start to cave in, and it could be due to some tight adductors, even collapses the medial arch of the foot. And so we want to work inside here and really start to lengthen that muscle so it doesn't pull on the knee or rotate this femur bone. So we're just going to go ahead and start by coming down onto the ground, into all fours, into your hands and knees. And all we're going to do is take this right leg and just slide it back. And then the left leg, we're going to have slide out in kind of this 90-degree angle here, kind of this frog leg here. So it's like a half frog leg. And just taking your time to come all the way down onto the ground, making sure that we're okay here. And all that we're going to do just to start off is really just lengthen this leg out, even press through the heel slightly, and then rebend. Bringing this knee, sliding the knee a little bit more up, even with the hip if you can. And the more you get that knee up, the more we'll be able to actually stretch this adductor muscle as you extend it and then rebend it. And so that's the first option, is kind of just staying there, exploring that. Or we're going to go ahead and possibly, if you have a tool at home, going to grab either a foam roller or somewhat of a therapy ball, a lacrosse ball, or a yoga tune-up ball. And I'm just going to grab a block here as well. And so just starting with the therapy ball, I'm going to come back into that same position on that same side. And I'm just going to use the therapy ball to kind of go on the inside of the thigh. So we're working anywhere from the knee up to the groin. And the therapy ball is really good to kind of target some of those trigger points and go deeper into this muscle. In the same thing, I'm just going to relax down here and just begin to lengthen and rebend. So as you straighten the leg and you rebend, you allow that muscle to kind of extend and contract while the therapy ball is kind of holding it in place. So it's creating that shear and releasing some tension. And then you just move it up closer to the knee or down closer into even the psoas or the groin, releasing any tension there. Because if this is tight too, it pulls all the way up, even through the pelvis, right? The psoas muscle, which connects the inner thigh with the front of the spine, if that's tight, pulls right into, pulls on the front of the spine, tilts the pelvis, creates a lot of issues even in the low back, and a lot of issues squatting. And we just stay there. And if you were to use, let's say, a foam roller, you could almost here, just kind of exploring on the inner thigh, you can even just kind of shimmy from side to side on it, or just feel that out, maybe even rotating the leg up and then back as well. Or continuing with that, extending the leg and rebending. Just using the tool to kind of hold that muscle in place while we do the work on top. And then when you stay on one side for about 3 to 5 minutes. Then we switch sides. And then we kind of come up and we just kind of retest this muscle a bit. So we just come up to a standing position and we just come into some kind of ninja squats here, allowing the toes to point forward as much as they can, because the more they're up, we'll get more of the back of the leg, more of the hamstring, which is okay because all these muscles are connected. However, just to target that muscle specific. But as we're doing this and we're moving side to side, just make sure that you have control, right? We don't want to get stuck here. So stay as high as you need or come as low as you choose and just allow yourself to move a little from side to side. You can stay here for 5 to 10 seconds, breathe into it, or you can continue to move just back and forth, allowing yourself that kind of control as you stretch and contract the adductors. If you have any questions, go ahead and leave those in the comments. And if not, make sure you hit the subscribe button, and I will see you all next time.